Hi, I'm Brooke McKenzie. I'm a licensed clinical social worker and I'm the Chief of Clinical Care Services here at DreamLife Recovery. Parental enabling is behaviors that we see by the parents that, although are well-intentioned, inadvertently support or perpetuate their child's substance use or addiction. These behaviors prevent the child from facing natural consequences of their actions, which can hinder the recovery and development of personal responsibility. And enabling can take many forms, and a lot of times we see it in finance, we see it in living arrangements, we see it in whether or not they need to go to treatment and stopping legal consequences, but it usually manifests itself through specific actions and patterns of interactions. The number one largest psychological motivation is protection. Parenting is hard, and we really want to do whatever we can to protect our loved ones, making sure that they're safe in any way that we can. And I think with addiction, even though it's completely out of our control and we recognize that it's out of our control, if there are ways that we can protect, we're going to do that. And it's the way we show our love. We want to show our love by engaging and staying as close as possible and trying to keep them safe, keep the loved ones safe, and making better choices and assist them in areas that could be a safety issue down the road. We recognize that part of that too is on fear and anxiety. We don't know what their day looks like when they're not with us. If we can keep them at our house where we can keep our eyes on them, we feel like we have more control over their use, that we might be able to stop their use altogether. Anxiety about what the future holds for them as far as employment goes or legal consequences. We have a fear of their consequences. We don't want them to end up with any kind of hepatitis or HIV or, legal issues. Maybe this is the first time they've gotten in trouble and we don't want them to lose their job or not be able to find meaningful employment down the road. Guilt and responsibility is a big part of it. We blame ourselves in regards to what we could have done differently, what we should have done differently. We have the desire to fix. Is there something we could do to fix the problem and jump in now, even though they're adult children, and like I said, fix whatever the thing is that we think we broke, maybe as parents. There's a little bit of hope and denial. The hope is that if we can do this, or if they know this, or if we get involved in this, that we can maybe help them, get out of this quicker. Denial and the severity of their use. We only see a small part of it. So we like to think, well, it's not that bad. And they're telling us it's not that bad, so it mustn't be that bad. Or this is the first consequence they had. And so our own denial in regards to what their addiction looks like. A little bit of control and helplessness. Again, as parents, we like to control what's going on with our kids, again, regardless of their age. And we can't control what they're doing and how it's going. And so we feel helpless in a lot of ways. And so if there are ways that we can get more involved so that we don't feel as hopeless and we can put our hands in more of the control area, we want to do that. Sometimes it's family dynamics and, past patterns that, our children saw us, what we were doing when we were maybe in active use before our recovery or still now during our active use. Maybe it was other family members like, their dad or their cousin or their uncle that they were involved in. And so, again, it's part of what we're used to and the narrative that our family dynamics shows. Sometimes it's social and cultural. That, again, alcohol is a big one on the social end. We think that everybody drinks socially. And so it's just a normal part of being a kid or even an early adult. And when they get older, they'll stop drinking as much and stop partying and, settle down. But then that doesn't happen. Sometimes we have that short-term relief or that immediate gratification, like if I do this, then maybe that will stop the problem immediately. But that's not the case. Addiction it took a long time to develop, and it takes a long time to find recovery. And there isn't an immediate solution to the problem, unfortunately. And as parents, we don't love that answer. The signs of enabling are difficult because oftentimes, again, as parents, we see these signs of enabling as the demonstration of our love and dedication to our kids. But there's a fine line between the dedication and love and enabling. One of the bigger areas is shielding our kids and family members from consequences. It is really easy for us to want to, well, they had this DUI, but if I can pull some strings and maybe get the DUI dropped, or I can talk to their boss and get their boss to keep them employed. We can hide them from those consequences. And what ends up happening is, if we don't let them feel the consequences, the addiction just continues, and we continue to see issues and more issues until we no longer have control over fixing and shielding the consequences. Providing financial support is a big one. Everybody, when somebody's in active use, money is something that's an important part of continuing active use, and there always is a need more money. And if I can give that as a parent, I feel like, well, they just need this for their rent, and they just need to be me to pay their rent, and that'll really help them out. They won't be as stressed. Or I'll be able to give them gas money to get to work. The situation is they're not using the money that you gave them for whatever the purpose is. Typically, they're using it for their addiction. And so it just continues to feed into the problem we're trying to stop. Taking over their responsibilities, jumping in to make sure that their house payment is being made, that their kids are being taken care of, that the kids are going to school, and whatever the other things are that we can take from them in regards to responsibilities, that we want to do it so that we can help them have a break or make sure that these continue and that they don't have consequences like I first mentioned. Ignoring or delaying the problem. We want to pretend like it doesn't exist. Well, it was just a bad day for her, or, it was a bad time. They were going through a rough patch. And, denying that anything is going on is, one of those areas where we see enabling happening. It wasn't as bad as you think it was. It was just, it was starting to get there. We wanted to make sure it didn't go any further versus this had been going on for years. One of the areas that we see as far as signs of enabling is prioritizing your kids' needs over anything else. So even though I'm calling off of work, I'm missing my own payments, I'm doing these things that I have consequences as a result, I'm making sure that my kid doesn't have those. And so I'm leaving work early all the time and putting myself in jeopardy to focus solely on whatever the needs are of my kid who's in active use. Emotional reactions like overcompensation with affection, that we're really like, we know that addiction is deadly. And so I don't want to see my kid head in that direction. So I want to make sure that I'm trying to let them know that I care about them, thinking that I can help pull them out of the depths of addiction with my love. Feeling excessive guilt. We talked about that a little bit earlier in regards to how that impacts parenting. And then, of course, our piece of that is our overcompensation with affection and our emotional reaction, because somehow it was my fault, and could I have done this, and should I have been home more, and what could I have done differently, which motivates our enabling. Avoid setting boundaries, that I'm like, you can't use drugs in my house, and then they come live with me and they use drugs in my house, but I don't kick them out. Telling them they have to go to treatment, but they do treatment for 3 days and then they want to leave early, and letting them leave early and coming to pick them up, or letting them move back into the house. Any of those situations where I'm setting a boundary saying you need to do this, and then not making them do that and letting whatever they do be good enough. Because, again, when they're in active use, manipulation is a high piece of that, and they want to, connive in any way they can to get their way, which oftentimes includes active use and not treatment. And so if I can make it seem like it's your fault or blame you in some kind of way, or any of that manipulation on the client, and they're going to do that. And so we need to identify that. Making and holding to firm boundaries is a very important part of the process to stop enabling. Another sign is justifying their behavior. Well, when he was 12, his dad died and it was a really rough time and he's just never recovered from that. Yeah, that was a really rough time, but that doesn't, continue to enable his behavior now 10 years later, or things that he could have done and didn't do to treat that symptom. We want to make sure that we're holding him accountable or her accountable to what we expect of them, now as an adult. Overprotectiveness, again, that we're trying to jump in there, and it's like my brother analogy, where it's like, I can say this about my kid, but you can't say this about my kid. And so I'm overprotective, and I know that you're saying these things and you think that you're being helpful, but I feel like you're attacking me and you're attacking them. And so I stop the conversation with you. Maybe I pull them out of treatment because I don't like what I'm hearing from the therapist. Or I stop going to therapy myself because I don't like what the therapist is saying to me about what I should do with my kids. So any of that overprotectiveness and making decisions as a result of how do I continue to protect the person that is my kid or loved one. A lack of consequences. Again, if I can keep those consequences from occurring, then the person continues in active use. And so I want to keep those consequences off as much as I can. So if I can pick them up when they're leaving rehab early, instead of letting them figure out how they're going to find a ride home and how they're going to make, where they're going to live and how they're going to make those payments, then I feel like I'm doing the right thing. I'm helping them in a situation where that actually continues to further the problem. All of the enabling behaviors that we had discussed up until this point have a very negative impact to the recovery process. And even though we're doing it for loving related reasons and we think we're being helpful, the exact opposite is actually occurring. In all research, it suggests that there's a worsening of the addiction outcomes, including longer active use, longer duration of use, more relapses, poorer treatment compliance, meaning people are dropping out of treatment, not completing treatment, leaving treatment early, and not finding recovery. We recognize that we do see in also the research that addressing enabling behaviors and teaching parents new skills can have better outcomes for the individuals. And so if you have a program, if your loved one is in treatment somewhere that offers a family program to help work with the families and help teach families coping skills and ways not to continue enable, the outcomes of those clients are going to be improved from clients who are in treatment where there is no family program. And part of that too is changing the family dynamics. And so as we're learning new coping skills and setting boundaries and holding those boundaries, those areas are improving the outcomes of our loved ones, and they're ending in more successful long-term recovery compared to the high levels of parental enabling that we would have seen previously. So if you're concerned that you might be enabling your loved one in some kind of way, there's a number of areas that you can look into, and here are some of the ways that you can intervene. So there's many strategies that you can utilize, and a large portion of it depends on what exactly the main enabling behaviors are that you're using. We see all different kinds of behaviors being used by family members. So it would depend on what that specifically was. And I'm sure if you're involved, if your loved one is involved in treatment somewhere, that they have a family program, the therapist and the engaged staff here at DreamLife, the liaisons, would be some of the people that could give you some valuable feedback on specifically what you're doing and ways in which to stop that. But the overview would be self-reflection and education. A lot of times too, the reason that we're doing this is because of us, that somehow, again, I feel inferior. I feel like on the parenting front, one of the things that parents don't tell new parents is that there's a lot of guilt. Even if you're doing the right things all the time, like you don't know, is it too much? Is it not enough? There is no book. And so a lot of times it is, I need to take a step back and realize that regardless of how good or not good I did previously in parenting, that I needed to make new decisions starting today moving forward, that I didn't nail it every day, and that's okay. Nobody nails it every day, and that you can move forward thinking of you and getting treatment yourself and learning what enabling looks like. I think that the first step is to understand even what it means and then the ways in which you're demonstrating that enabling. Seek feedback. Like I said originally, if the person is in treatment somewhere that they offer a family program, listen to what the person telling you is saying. The therapist's goal or the liaison's goal is to give you honest feedback based on what they're seeing. And yes, they're not in your family and they may not know the intimate secrets of what that family life looks like, but they can see what, from afar, the 30-foot view of what's going on in the family and give you some really valuable feedback on how to fix that. And also, like I said earlier too, therapy. I think that as a parent, if you find and seek therapy yourself, I think they can give you a lot of good feedback in areas that you can make some changes. Identifying patterns. Again, loved ones that are in active use oftentimes have their own patterns. And so if we can see their patterns, then we can see what our patterns are in response to their patterns. And then, figure out new ways to behave. Recognizing that we're noting the consequences, like what is the consequence happening and how do I let them feel that? It's like a chess game, right? They make a move and then I make a move. And so where is my end game? If my end game is treatment, to get somebody into treatment, my loved one or my kid, what do I need to do to make that step to go in that direction? And then when they make a move, I have to reevaluate and then make a different move. Cannot say enough about establishing clear rules. And now again, we probably didn't have many boundaries before, and now we're starting to set boundaries, so it's not gonna go good, right? We're gonna say, we're not gonna do that, and they're gonna do it. We're gonna say no, and they're gonna push those limits, and we need to stick to those limits. Because if I say no 5 times and I say yes the 6th time, I just undid all of the 5 no's that I said before. And so we're just cutting off our nose in spite of our face. We're making the situation way harder. We set the boundaries, say, you cannot return home unless you've completed treatment. And by completed, I mean everything that they expected you to do. And then we stick to that. that we're being consistent, that it's not your version of what you think treatment is, it's what the treatment's version of what you think treatment is. A lot of times we see clients coming in, they're like, well, I'm only going to do detox and then I'm going to do outpatient, which can that be successful? Absolutely, but in 1% of the general population. So if your goal is to have as much success as possible, we want to do something different. And as a facility, we're going to tell you that, and then sticking to what it is that the facility is saying, not what they're saying. They don't know, sticking to what we're saying as the facility. Encouraging responsibility, again, that there is a cleaning up portion of early recovery. It's like we've been running in active use from all of these consequences. And when we finally stop in treatment, all of the consequences are like smacking us in the face, right? Legal consequences and family consequences and children and youth maybe, and I lost my job, everything's happening. But part of what we need to do as the family is to say, yeah, it stinks. Like, this is a terrible situation to be in, but what do we need to do next to get through this? And then help, holding them accountable to that responsibility, that if, I'm playing with Legos and I throw them on the floor, I have to pick them up. That's part of this, right? So I made some of these messes. I need to clean them up. I will support you as your mom. I will support you, or as your loved one, I will support you, but you need to do the cleaning up of that. Avoid rescuing. Again, it's much easier for me to come in and clean the Legos. But if I do that, then there isn't anything learned as a result of it. And so we're setting those boundaries that you're going to do that, and then we're going to hold them accountable to doing exactly what it is that we told them originally. We're going to focus on supportive action. So we're going to offer emotional support. We're going to offer encouragement, anything that we can do to support that. If they're in treatment and we need to, make sure that their kids are getting to school, that's great. As long as they're in treatment, we'll do that. If we need to, if the facility's calling and they're saying, hey, we think that longer treatment would be better, or maybe a higher level of care would be better, or something along those lines, working to help and support your family member in making that choice. Oftentimes longer treatment is a hard choice, but as a family member, we can support them in making that choice in the supportive actions. As they're doing the right things, we will help and offer that support for them to continue doing those right things. Helping to develop a new support system. Again, oftentimes our loved ones have destroyed their support system. They don't really have much happening in that area. And so we can help, right? Help to make sure that they have a support. We can be part of that support. We can make sure that they get a therapist, they're going to meetings, maybe 12 steps, smart recovery, whatever they're interested in. They're seeking counseling, we're seeking counseling, but that we all have our support so that we can make sure that we're all staying even and level, staying above water, that if I'm supported, then I can support you, and that we're supporting those emotional needs. Practicing self-care is important. Again, during the time that our loved ones were in active use, we're not sleeping, we don't know when the phone's going to ring, and it's going to be something very serious and terrible. And so during the time that they're in treatment, it's time for us to take care of ourselves. And so what can we do to make sure that I'm getting, some me time? I'm going to start doing some things I used to enjoy, and maybe getting outside, or hanging out with friends that I haven't seen in a long time. But I'm going to start taking care of myself, and I'm going to start setting limits. It's not all about what I can do for you, that I have to take care of me too. And then I'm going to prioritize me taking care of me as well. Communicate effectively. We're going to use I statements. So, I statements are important in that this is what I think about it. I'm not telling you about you. I'm talking about me. That we can be honest. This is how I feel about what's going on, and this is where I have struggled with some of the things, or this is how I feel about some of my role in what the situation is for you. We can have some of those open conversations where we're going to communicate effectively, and the same thing too on the honestly. I think that it's always better to lead with, you can't come home unless you finish treatment, than pretending like, well, maybe you should do this, or let's explore this, but what I really mean is, no, you can't come home. We just need to say that. We need to be upfront with, this is an expectation of mine, and I'm going to communicate that effectively with you. We're going to allow natural consequences. So if in fact you break the law, there are legal consequences for that. Or if in fact you don't go to work, there are natural consequences for that. And we're going to stop interfering with that. We're going to watch those natural consequences happen, and then recognize that whatever we need to do to support them to address those and help to get back in the swing of it when we've entered into treatment and or are finding recovery. And we're going to resist intervening as hard as it's gonna be, and watching this situation happen and knowing we probably could help in some kind of way. We're going to resist doing that, and recognize that if the end goal is to treatment and recovery, then this is going to get us there quicker. Creating an action plan. One of the things we do here at DreamLife that I think is really helpful, especially if we're intervening with somebody, you have a loved one who doesn't want treatment, you're frustrated by their behaviors, you reach out to DreamLife to say, "Hey, can you help me?" Or like, yes, we will send out our interventionist. The interventionist comes out, let's create an action plan, and that we're all going to be on the same page. So our interventionist will give you very clear outline for what it is that they're going to expect and what role they're going to play, and then you have your own role. So what is your role and what does that look like? Listening to what they're saying and then doing those things. It's really pretty easy. Sometimes it's just when they say, "Can I come home?" you're going to say no, and then you just stick to no. It's not hard. It's not a difficult task, but it is very hard to do. And we're going to set those goals, and we're going to develop the plan, and then we're going to work the plan. And that's where you're going to see the successful outcomes. When everybody working with the loved one is all working together as a well-oiled machine with the end goal of getting the loved one into treatment and finding recovery, that's when we see the most success.